Arizona is facing a statewide primary care physician shortage, and the problem is expected to get worse over the next 10 years.
A bill that's being moved through the state legislature could help alleviate the doctor shortage. New at 10, 9 News Side's Natalie Terrangioli explains how the bill would entice doctors and nurses to stay in Arizona and in the areas they're most needed.
All counties across Arizona are currently experiencing doctor shortages. Research from the U of A Center for Rural Health ranks Arizona near the bottom nationally.
And so many medical students come out with such huge debt that they have to go look sometimes for the money rather than the location.
The doctor shortage is just one part of the problem. The other part, Rick Anderson, the chief medical officer at TMC, says is getting physicians out into rural areas like Santa Cruz and Cochise counties, where the shortages are even worse.
You really have to be driven to really want to practice in rural areas, no matter where you are in America. It really is something that you have to be sometimes called to do.
An estimated 563 physicians are needed right now to eliminate the state's shortages, and by 2030, that number jumps to almost 2,000. Senate Bill 1354, moving through the State House, would help tackle the shortages. The bill would split $50 million between 5 programs to entice doctors who train in Arizona to stay. Funding would go toward residency and medical programs, loan forgiveness, and nurse training. Anderson believes the programs would help retain medical students from the U of A.
For us, getting extra funds to actually develop other residency programs and develop them here in Tucson, I think really would promote keeping those physicians here in Tucson, especially in the primary care areas.
Another reason for the doctor shortages, the chief medical officer at TMC says burnout is also a big factor. Work has changed over the last couple of decades. There's more paperwork, phone calls, and of course moving to electronic health records. He says those factors are leading to early retirement, and so this problem is really complex. It's really about attracting people to the field and then keeping them.
And something needs to be done now, because in 10 years you showed almost 2,000 doctors
Big
short.
time, yeah.
Yeah, and the VA also has problems, similar problems
I'm
as
sure,
well.
yes,
So,
exactly. Thank you, Natalie.